We now explore the final part of our lessons, and that is death and dying. We're going to look at aspects of death, palliative care or care for the dying, and the grief process. There have been changes in the leading causes of death in the last 100 years. Life expectancy has been increased by about 25 years. In the year 1900, infectious diseases such as tuberculosis and influenza were #1 killers. But by the year 2000, chronic diseases such as heart disease, cancer, and stroke are now the major killers. The most common causes of death in the United States include heart disease, malignant neoplasms or cancers, cerebrovascular disease or stroke, chronic lower respiratory disease, accidents, diabetes, Alzheimer's disease, influenza, and pneumonia. The deadliest diseases worldwide vary depending on the economic conditions of a country. For example, in low-income countries, diseases such as malaria and diarrheal disease, perinatal conditions are leading causes of death. There are several aspects of death. The biological death refers to vital organs ceasing to function. As a person goes through the process of dying, the body begins to go through a shutting down. This is accompanied by an increase in sleep, perhaps. The person may stop eating as digestion begins to slow down. The blood may pool on the underside of the body and form dark patches or mottling as circulation slows. And breathing can become more sporadic, more raspy. Clinical death occurs when the brain ceases to function. Social death refers to a time when people stop calling or visiting someone who's terminally ill or in the dying process. Even healthcare professionals may find that they spend less and less time with their terminally ill patients. The informal description I've heard has been to refer to a patient as circling the drain, meaning they're on their way out. Most social death occurs because people feel very uncomfortable around those who are dying. What do you do for those who are dying? The #1 answer is be there and listen. No one really expects things to turn around or to be offered solutions. Psychological death occurs when a person begins to accept their death and begins to withdraw psychologically from others. They may be less interested in normal activities or in world news or social relationships. But this can occur much sooner than biological death. In the late 60s, Elizabeth Kubler-Ross began to write about death in the United States. And she marked the entrance of the hospice movement in the United States with her book On Death and Dying, published at about that time. Kubler-Ross outlined 5 stages, psychological stages, of coming to grips with one's terminal illness. These can also apply to coming to grips with the news that some loved one is terminally ill. These 5 psychological stages of dying include denial, anger, bargaining, depression, and acceptance. We know that there's no right way to grieve or to come to grips with one's own death. But what we may find is that a person can visit these on several occasions in different orders or not at all. Nevertheless, these stages have been very useful in helping to understand what to offer a person who's in this situation. Hospice is a program that offers death with dignity as much as possible. We've seen a hospice movement in the United States since the 1980s. The word hospice it comes from a root that means hospitality, or a place for travelers, a home for the sick. The modern hospice movement actually is traced back to London and Dame Cicely Saunders. She believed that people who are dying should be given autonomy of choices about their life. They should be allowed to live always, fully, without being ostracized or isolated. And they should be offered the mechanism to die peacefully with comfort. Saunders outlines 7 pains or 7 areas that hospice needs to address. Physical pain, spiritual pain. This is often addressed by a clergy member as part of a team that delivers hospice care. Intellectual pain may be experienced particularly by those who have Alzheimer's disease or some other dementia. Emotional pain, such as depression, needs to be addressed. Interpersonal pain, or the kinds of rifts in relationships that come to surface as a person is dying between family members. This also needs to be addressed, and often it is, by a social worker as part of the hospice team. Financial pain. Interestingly enough, this is one of the major concerns that people may have as they are dying. They're concerned about what kinds of debts, medical expenses they may leave for their family members. Bureaucratic pain. This refers to the difficult, time-consuming task of trying to get information to insurance companies, to file claims, and so on. A hospice team can offer assistance in all of these areas of pain. Palliative care is a branch of medicine where the focus is on care for the dying. In palliative care, comfort and pain relief are major concerns. Some of the discomforts that those who are dying may experience include nausea, shortness of breath, ulcerated bed sores, and physical pain. Pain medication is often offered, and with some controversy, of the double effect. Morphine, for example, can not only relieve a person's pain, but it can accelerate the timing of death. Palliative care is philosophically based on the appreciation that people should be allowed to die with dignity and as much control over their death as possible. Hospice includes a team of individuals all geared toward helping the dying person and their family to go through this process. The registered nurse, or the RN, provides total care. The social worker tends to focus on family and legal issues. A chaplain may be part of a team who addresses spiritual needs. The CNA will provide bathing and grooming, direct patient care. Of course, that's in concert very often with family members. The physician oversees medications, and volunteers provide a number of services. You can read about these and listen to some examples of these in your lesson. Now let's explore grief and loss. There's no right way to grieve. People grieve in a variety of ways. Those who have the knowledge that a family member may be dying for some time may experience anticipatory grief. And although once a person dies, it doesn't mean that there's no more grief to experience, but it does mean that a person may be able to psychologically adjust prior to the death. Grief often brings very, very mixed emotions. I highly recommend the book On Grief and Grieving by Kubler-Ross to address some of these complicated emotions. What do you do for those in grief? Again, the answer is be there and listen. Some people are not really given social sanctioning for grieving. This is called disenfranchised grief. For example, those who have a relationship that can't be brought into the public eye, for example, if it's an extramarital affair, or those who may have grief over an ex-spouse, tend to not get the support of others around them.